Hello, this is Cole Whitaker. I'm the Chief Commercial Officer with Powered by MRP. Today we're going to be going through the Train the Trainer on the Quanta System Echo. This is a brand new exciting technology for hair removal. We are the U.S. distributor for this product, so we are bringing on trainers at this moment to be training these systems as we sell them. With me today I have Ryan and Lorenzo. If you guys would mind introducing yourselves.
Yeah, hi, my name is Ryan. I'm the Clinical Training Director here at MRP.
Hi, my name is Lorenzo, and I'm the Product Manager from Quanta System.
So first thing we're going to do is we're always going to give a kind of a disclaimer. These are things that when you're doing a training, it's not a bad idea to just kind of walk through this, but for the most part what you're reminding the office to do is that ultimately they're responsible for their own decisions. They need to use their medical guidance, their training, in order to determine what the best practices are and how to ensure the safety for their patients. But ultimately, the manufacturer and the distributor, you yourself, we are not held liable for the guidance that's set forth in this in-service. So today we're going to talk about technology. We're going to talk about skin, treatment protocols, settings, documentation, questions, live treatments. We're going to go through how to calibrate, how to set up the ecosystem, how to connect the various hand pieces and change out the spot sizes. It's going to be a lot of information, but you'll have this as a recording, so you're able to go back and kind of refresh on this before you do a training in the field. Everything, of course, begins with selective photothermolysis. The theory of selective photothermolysis, originally by Dr. Anderson, Dr. Parrish, really sets out the idea that we can take a specific wavelength and a spot size, a pulse duration, a fluence, and we can get safe and predictable outcomes in patient after patient. That this is not just guesswork. It's not, we're just going to see what happens. We know exactly what we're doing with any specific wavelength. We know what happens when we change our spot size. We know what happens when we change our fluence or our pulse duration. So these laws are what govern everything that we do with every laser that we operate from MRP. Key terms that we want to remember. Wavelength, that's literally the distance from one crest of the wave to the next. So if you drew out a wave on a whiteboard, you could measure the distance from the peak of that wave to the next peak of that wave, and that distance is going to be measured in meters, or in this case, because we're talking about tiny little wavelengths, nanometers. And so the wavelength is always measured in nanometers, and that's the distance from one crest to the next crest, and that's what's going to help determine our target chromophore. So the wavelength for the echo system is an 808, and 808 is attracted primarily by melanin, and so we're chasing the melanin content of the target. Chromophore is just a fancy word for target. That can be melanin, it can be hemoglobin, water. There are various chromophores that we're targeting with different wavelengths, different types of lasers. In this case, we are targeting the melanin content of the hair matrix. Thermal relaxation time is kind of a funky thing to learn if you've not worked with this before. The TRT of a target is the length of time measured in seconds, or in this case milliseconds. It's the amount of time that it takes for that target to give off 63% of the incident heat. Incident heat meaning that we were at baseline temperature before, we applied a laser, and now how long does it take for that target to give off the incident heat? If you've got kids, you probably know that if I cook a hot dog in the microwave, I take the hot dog out, it's going to be hot and it's going to remain hot for quite a while. Whereas if I cut the hot dog up into little tiny pieces, those tiny pieces would cool off much faster. That's the application of TRT in real time, that smaller objects will give off heat much faster than larger objects. Larger objects take longer to heat up and will maintain that heat for a much longer time. The pulse duration of our laser needs to be shorter than the TRT of the target. And so that's where these two things are very related to one another, but they don't mean the same thing. An object has a TRT, a laser has a pulse duration. And the idea is that your pulse duration should be shorter than the thermal relaxation time of the target. Here's our coefficient of absorption chart. This is really something to understand for all lasers, that melanin starts, you see right over there on the left-hand side, about 1,000. That as the wavelengths get longer, within the visible spectrum, the absorption of melanin continues to decrease. So a shorter wavelength is going to have greater absorption into melanin. That's why we can't use, let's say, a 532 for hair removal. It would never make it through the superficial pigment of the skin in order to reach the hair matrix. It simply can't penetrate to the depth of penetration necessary. But as you start getting longer and longer, a 755 is a great wavelength for hair removal, but it still has a lot of absorption by epidermal melanin, so it's not safe for skin types 4, 5, 6. A 1064 is much safer for skin types 4, 5, 6, but it doesn't have nearly the melanin absorption that a 755 or even an 808 might have, and so it requires much higher fluences, it's going to be much more uncomfortable, etc. And the 808 just really fits in a nice sweet spot in the middle to where you are able to pass transparently through the melanin content of the epidermis and reach the hair matrix and be selectively absorbed by the melanin content of the hair matrix. So the availability of spot size of a laser device is another factor that influences the efficacy of laser treatments. A larger spot size inherently allows for treatment of larger areas more quickly than a small spot size. A bigger spot size reduces the scattering side effects, resulting in a more efficient energy transmission to deep skin layers. Once the energy is given a spot size, it's measured in fluence. Power is measured in watts, energy is measured in joules, or millijoules in this case, and then fluence in a meter square. The wavelength, the pulse duration, and the fluence are the most important parameters for achieving the desired treatment effect. Structures of the skin. Those hairs that are sticking out above the skin, irrelevant to the treatment, and if anything, they're detrimental to the treatment, because as the laser's coming in from above, it's going to be selectively absorbed by the shaft of those hairs sticking up above the skin. So that means the energy that was meant to go down to that hair bulb, the hair matrix essentially, is being stolen by those hairs that stick up above the skin. So we always want to shave the surface down flat to the surface because those hairs sticking up will also sometimes lay down flat onto the skin and get singed into the skin. They'll kind of burn on the surface, and they create a very itchy sensation for the patient that's uncomfortable. So we'd rather pass transparently through that superficial layer so we can reach that hair matrix to get greater destruction of the hair itself. Hair growth cycles. We can only treat the active anagen phase when doing hair removal. We're not affecting the catagen or the telogen phase. We're targeting the anagen phase, and that's seen in this graphic. And then on this next page, we're going to actually have a chart that will show you if somebody really wants to dig into, well, how long is the anagen phase? This chart will help you to break that down and show really how long each one of those are, the percentage of hairs that are within that anagen phase, etc. But the general rule of thumb is head, we can treat every 4 weeks, torso every 6 weeks, legs every 8 weeks. General rule of thumb, that's going to give you basic guidance, but the first, let's say, 3, 4, 5 treatments should follow roughly this guideline. But as you start to get to later treatments where the hairs just aren't growing back as thick or as robust as they were before, what you often want to do is wait for that regrowth. And so if we ask the patient, let's wait for 30% regrowth after treatment 5, let's say, it may be 6 months before they're due for their next treatment. And you can continue that as time goes on. Then maybe it's 6 months down the road or 9 months down the road before they need their 7th treatment. All of this is moving towards permanent hair reduction or temporary hair removal. These are kind of interchangeable with the two. There's no such thing as permanent hair removal. That's really reserved for electrolysis, I believe. So the high power and large spot size of the echo allow for the treatment of very deep skin layers in order to damage the hair follicles of all the treated body areas. To be effectively damaged, the hair must be in the anagen phase, and the hair must contain melanin. The treatment of gray, white, or clear hairs may not be effective. Now, there may be melanin within, let's call it gray hair, that you might hear that described as salt and pepper hair. Well, we can treat the pepper part, we can't treat the salt part, because there needs to be some melanin in order to capture the laser's wavelength. And so the lighter the hair, the harder it's going to be. You'll see marketing messages about being able to treat finer, lighter hairs. There's always an R on the end of that because it's by comparison to what we were able to do before. I don't think it's fair to necessarily race out there and say, hey, we treat blonde hairs, because blonde is really a spectrum of colors. If we go from 1 to 10, with 1 being white or clear and 10 being dirty blonde, these are all blonde hairs, but with typical lasers, we could have treated 7, 8, and 9, and with the shortened pulse duration, the higher peak power of the echo, we can actually get down to maybe 4, 5, 6. So we're able to treat finer, lighter hairs than what we could do before with traditional, especially diode lasers. It's important to cool the skin immediately before the treatment to prevent epidermal damage due to competitive absorption of optical energy by the melanin contained in the epidermis. Potential damage to the epidermis is minimized if the epidermis is cool and the laser pulse width is longer than the TRT, which is estimated to be 6 to 8 milliseconds. Overcooling with the Zimmer option must be avoided. There is a way to perform hair removal using a Zimmer attachment to the handpiece, and it doesn't need to be overdone. This is a very comfortable laser if performed appropriately, and overcooling is not necessarily in your favor. It is sufficient to expose the skin to airflow for just a few seconds and move on. Skin typing. There's many tools to use with skin typing. This is as basic as it might be, but you always want to take into consideration the culture of the patient. How is their body going to respond to an injury? How is it going to respond to sun? If they have a bee sting, does it swell up and turn into a brown spot afterwards? There's all sorts of questions you can ask, and there are great resources on the internet to work with in order to help customers decide how deep they want to go into skin typing. With the Echo, it's not as vital as it might be for some other systems like an IPL. The range of treatments for skin types 1 and 2, or the guidelines for skin types 1 and 2 are actually the same. You know, skin type 3 may move the fluence up by 1 joule per centimeter square, or move it down, excuse me. It's a good idea to know this chart just off the top of your head, and then be able to ask those questions to dive in a little bit deeper and to help the offices understand skin typing, depending upon how new they are to lasers and the Fitzpatrick skin types. During treatment, the operator must remember that highly tanned skin, or skin types 4 and 5, 4, 5, 6, patients have higher melanin content in their skin. This may cause more laser energy to be absorbed by the epidermal skin layer as opposed to the melanin in the hair. This means that these patients must be treated with reduced fluence and longer pulse durations. Nevi must be preserved during treatments. The thermal damage such lesions and/or pigment in skin will potentially induce thermal necrosis with the possible tissue scarring. Protect any lesions and/or pigment in skin with a white dermatological pencil. The number of follow-up treatments depends on a number of factors, including the body area treated and the wavelength utilized. More than 6 sessions with intervals 4 to 8 weeks are normally needed. Typically, the treatment intervals become longer as the patient progresses through treatment sessions. Avoid follow-up treatments on patients without any hair regrowth, since a hair shaft and bulb are the main target of this treatment. To give you an example, years ago I had an office that had purchased a device, and 8 months later was telling me that they weren't getting any results, or they weren't getting the results that they had expected. And come to find out, he was treating his patient's legs every month. And so once we really reasoned through that the anagen phase was not recircling through that, we realized he was really only on treatment number 4 with each one of those patients, that every other treatment was essentially treating an absence of anagen phase. So it is important to understand those hair growth cycles as they apply to the regrowth of hair, and you can plan your treatments accordingly. Once I was able to explain this to him, obviously he was happy and understood that his laser was performing as it should. To minimize small epidermal burns during the treatment from singed hairs, the hair must be trimmed shorter than 1 to 2 millimeters. A good suggestion is shave bare 1 or 2 days before the treatment, so that you just have slight stubble. You don't need to have anything sitting up above the skin. It doesn't necessarily need to be shaven down bare the morning of, because what might happen is you could singe off the very tips of the hairs, and then they get sort of trapped just beneath the surface of the skin as it gets tightened down a little bit from the heat. Before performing the treatment, each patient must be informed of the benefits and limitations of the procedure. Once they've been properly informed and any questions that they have answered, each patient must sign an informed consent acknowledging their consent to the procedure. Consultation: do a full medical history, assess skin type, review expectations and compliance, review contraindication, review consent, review pre and post treatment, discuss schedule, and take photos. All of these are standard with any sort of a laser procedure, and certainly we'll want to continue that even though it's just hair removal. Okay? Contraindications: medications that cause photosensitivity. These are things that should be on their intake form. Accutane within 6 months, malignant lesions in the treatment area, herpes simplex. Most importantly is pregnancy and/or breastfeeding. We do not want to treat a pregnant patient under any circumstances whatsoever. Epilepsy, wounded skin, tan skin, active infections or immunosuppression, history of keloids, may cause scarring, or anticoagulant drugs or bleeding disorder. Provider considerations: retinol. These are up to the medical discretion of the medical director. Poor wound healing, photosensitizing medications, and autoimmune disease. Ultimately, this comes down to the decision of the medical director overseeing the practice. Pre-treatment, no sun exposure or tanning lotion, anything like that, the bronzers, none of that for 3 to 4 weeks prior to treatment. Shave, as we discussed before, we don't want to pluck or wax because we're removing that target that we need in order to have effective hair removal. Stop exfoliants 3 weeks prior to treatment, wash and dry the area, test spot. It's really, really important that when you're doing a training, you're teaching the office to perform test spots on all patients. That most people are used to just going right into the treatment and saying, oh, it's a skin type 3, we're just going to go ahead. Well, you would like to know with a single test spot that that patient was going to have an adverse reaction to laser with only one spot rather than having treated their whole legs. So it's important to do test spots, wait 30 to 60 minutes for skin types 1 through 3. On skin types 4, 5, 6, it's best to wait a couple, 3 days. So you might test today and then schedule their appointment next week. That way you know exactly how that patient's going to respond before you treat their whole face, their legs, their body. Safety check. Within the sapphire cooled handpiece, you have a window that can essentially catch that airborne debris and particulate. And so this window is meant to be kind of a sacrificial window to protect the expensive optics that are within the handpiece. And so that just simply slides out to the side. You can wipe that off. You can see if there's debris sitting on that. Wipe that off, keep that clean, make sure that it's clean at all times, as well as the window that touches the patient's skin. You can clean with pump alcohol on a 4x4. Check the cooling function before treating. This is really, really important that when you turn the cooling on onto the system, it starts dropping the temperature immediately. And within 10 seconds, it's going to feel cold, but if you really want the benefit for the patient, you need to let that run and continue to run for another minute before you start the treatment. Otherwise, as you start going, if you're at a high fluence for that patient's skin type, they're going to start to feel a little discomfort that's not necessary. That give it a little bit more time for that base plate to cool down. And the way I like to do this, we'll show this to you visibly later on, is to hold the base of the handpiece against the palm of your hand. So as you've hit the ready button, it's starting to cool the handpiece down. That's where you give the patient a little bit of a, here's what we're expecting, here's where we're going to start, here's what you're going to feel, and you continue to feel that handpiece dropping down. Go ahead and put it onto the patient's skin. Give it just a, hey, 1, 2, 3, one single pulse. How does that feel? Comfortable? Great. We're going to get moving. Now the handpiece is cooled down adequately, and we can start our procedure. Ensure proper eye protection. For the patient, this should be the occlusive shields, and then the providers have very specific eyewear that will match the wavelength of the machine, and those should be worn at all times. Skin cooler and cryo handpiece. You'll notice these two handpieces look very different. The one on the left is contact cooled, and you have a removable sapphire window. We'll discuss this later in the live treatments. The one on the right is designed to work with a Zimmer, and so depending upon the preference of the practice, they can do either one. The Zimmer handpiece is an even lighter weight handpiece, but it'll have the hose of a Zimmer connecting to that rear end of the handpiece that you see in the picture. Observations: mild to moderate discomfort, blistering, hyperpigmentation, erythema, edema. These are all things we want to be aware of. Adverse events are rare and can be minimized by following the established preoperative, postoperative instructions and using adequate techniques. Cooling options. We talked about this before. On the contact cooled handpiece, that base plate is going to chill down to, I believe, 4 degrees Celsius and maintain cold temperature up against the skin to drop the temperature of the skin down prior to the pulse, during the pulse, and after the pulse. If you decide to remove the sapphire window to slide easier onto the skin without gel, then you still get the benefit of pre and post cooling. You simply don't get the mid cooling that you would get if you operate with that sapphire window. The sapphire window can tend to be grabby, so as you're trying to pull without gel, the sapphire window sometimes creates a little bit of an obstacle, but we have found that using the sapphire window without gel is still an option for you. It's really a matter of titrating the pressure on the skin to make sure you're able to maintain contact and cooling while still being able to move. And that the design of the Echo contact cooled handpiece is very specific to do that. You can see the barrels at the top. These are the various spot sizes. Currently we have a 12, 18, and 24 millimeter spot size. The handpiece separates right there where it turns from gray to white. You press those 2 buttons on either side and then pull the white handpiece apart. In doing that, you can then slide in a different spot size and then slide the handpiece back together, and that's how you swap from one handpiece to another. Reverb mode. What's very popular worldwide is an in-motion, low fluence, high repetition rate hair removal. And what it creates is a pain-free hair removal experience for all skin types. This is a great way to introduce hair removal to a patient who's maybe afraid of lasers, but the in-motion delivery is going to be perhaps the slowest way to do hair removal. So a foundation of a practice is probably not going to be built off of the in-motion delivery that we call Reverb, but it is always available to you. And I like to use Reverb on the darkest Fitzpatrick skin types, knowing that I can maintain safety and comfort for that patient. And so it gives you one more tool within your shed to deliver safe and efficacious results. It's a basket woven serpentine delivery that's going to be continuously treating over that kind of 4x4 square, or imagine 10 centimeters by 10 centimeters. We're going to work in that same zone for about a minute for each one of those different zones. And the sapphire window must be in place at the time. Gel must be used for adequate sliding with this. And you'll continue to treat each 4-inch by 4-inch zone for roughly a minute and then move to the next area. One big tip that I can share with you guys is that the application of gel does not need to be thick and goopy. It just needs to be a thin coverage, and then you'll actually be rubbing it in with the handpiece. So don't let the office or the practitioner really fixate on gooping up the gel and spending a lot of time with the gel. They need to quickly just swipe applying the gel, and then when they're done with that zone, take the same tongue blade, scrape it off, and then swipe it onto the next space and get right back to moving. The handpiece itself will help to rub it in and get it to the far corners of your 4x4, and it'll allow them to move much, much faster. Final checklist. Verify the patient's suitable for the treatment. Check again the list of contraindications available in the manual. Clean the skin area of treatment. Carefully remove any cosmetics and ointment. Apply transparent gel to the area of treatment if requested by the specific application. Always wear laser protective goggles and proper application of patient eye shields. Ensure that handpiece cooling is activated and set to the desired level of 1 through 3, and verify by holding. I really like the idea of verifying by holding, just getting in the habit and teaching them to get in the habit of holding that handpiece base against your opposite hand. By doing that, you're going to ensure that the device is cooled and is ready to perform a treatment, and it's going to be comfortable for the patient. Treatment pearls. You should always be perpendicular to the skin. With any laser, that's really kind of a mandatory, that we want for the energy to be delivered homogeneously across space. So perpendicularity to the skin is important. Moderate pressure to create some vasoconstriction. Contact cooling without gel. If you're doing it without the sapphire window, it's important that you glide before you pulse. We'll show you this today, that if you don't have the sapphire window in place, you're not benefiting from the cooling at the initial pulse. So what you would do is you would start sliding towards yourself and then start your pulses once the expected spot size reaches an area that's already been pre-cooled. Work slowly with darker Fitzpatrick skin types. This is really, your emphasis should be on safety rather than speed and performance. I don't ever want to hear about how fast a treatment can be performed on a Fitzpatrick 6 skin type. That's not a place where speed is really a benefit. Safety is the most important thing when working with darker Fitzpatrick skin types. So move slower. A slower rep rate should be used with darker Fitzpatrick skin types. Longer pulse durations to make it safer for the patient. And I always use the sapphire window when treating Fitzpatrick 6, regardless of settings. The sapphire window is going to give that additional safety of cooling during the pulse. Ask for patient feedback. The hair removal with the echo shouldn't be painful. Adjust your settings for patient tolerance, that we really shouldn't have a patient writhing in pain. That's not the kind of treatment that we're looking to perform. You will get results with the expected treatment guidelines that we're going to provide here. Ensure that the handpiece cooling is set to the maximum if the patient's uncomfortable, that's going to help to drop the temperature down so they don't feel such a delta in temperature with each pulse. The graphic user interface is absolutely gorgeous. When you turn the system on, you move into the treatment configurator. It'll ask you, is this a male or a female? Are we treating a face, an armpit, the abs, the abdomen? You'll simply select each one of these, and then it projects to the next screen, where you then select the skin tone, the thickness of the hairs, the colors of the hairs, and then you can progress. What it'll next pop up with is a choice of usually one or two different settings. But before you get to this screen, there's another screen in between that'll say, do we want to do it with the standard settings or do we want to do it in reverb mode? And you'll select usually the standard settings, and then it'll project to this next screen that gives you all this normal information that you're looking at. So starting at the bottom left, there's our cooling. Cooling should always, always, always be on. The default is off because we don't need that coolant circulating through the handpiece at all times when the machine's in standby. So after you touch ready on the screen, it will ask you to confirm which level of cooling you're using in case you did forget to turn the cooling on. But if you go left to right, you should always start with turning the cooling on. Then your fluence is relative to the spot size. So a larger spot size does not require high fluence. This is setting using a 24 millimeter spot size. And for those of you who've used a 24 millimeter spot size on other systems, you'll know 17 is very high. So this setting, this would be a great treatment for skin types 1 through 2. It's probably, maybe the fluence is a little high. Let's imagine we were 16 or 15 joules per centimeter square on skin types 1 and 2 for a first, second, third treatment. The pulse width at 36 milliseconds is shorter than the TRT of most of the hairs that are in the active hair cycle for terminal hairs. So the hairs on my head, these are terminal hairs. The hairs you might have on your cheek might be more like vellus hairs. Terminal hairs typically have a thermal relaxation time of 30 to 100 milliseconds, while vellus hairs have a thermal relaxation time of 10 to 30 milliseconds. So as you get into later subsequent treatments, the hairs get finer and lighter as you go, and that's where you would need to move to shorter pulse durations and higher fluence in order to capture those hairs. So right now we're at 24 millimeter spot size, 17 joules per centimeter squared, a 36 millisecond pulse duration. At the 24 millimeter spot size, your pulse width is typically about double the fluence. And so somewhere in that range, that's where you're going to want to be. And then as you start getting more aggressive in the later, the 4th, 5th, 6th, 7th treatment, that's where you want to start dropping your spot size down in order to get to a pulse duration that's shorter to accommodate that larger or that higher fluence. And then your rep rate is based on the overall power output of the system. So depending upon what these settings are, your rep rate could be as fast as 4 hertz in a standard delivery. You can really titrate that based off of your kind of hand dexterity, that how good is your hand-eye coordination to move and make sure you have proper overlap with your pulses, make sure that that you're treating the entire area, you're not leaving gaps in between. My comfort zone has really been the 24 millimeter spot size at 2.5 hertz. That seems to work really well for my eyes and my hands to work together. So you can work with the office starting slow and then moving a little bit faster and a little bit faster as they progress throughout the day, and they'll appreciate that. Just beneath the 24 millimeter icon over on the right-hand side, you'll see that you can select either the trigger on the handpiece or the foot pedal. This is just a matter of preference. If you grew up on Qterra lasers, you're used to using a foot pedal. If you grew up on Palomar lasers, you're probably used to using a trigger. So really, you have a choice. You can do either one that's most appropriate for you. Here's a chart from the manufacturer. These are the settings that are built into your guidelines. So if you simply follow the treatment configurator, as we just looked at on the screen, these are the settings that will pop up as your suggested settings. I've also worked with a number of doctors here and locations here in the United States to come up with settings using the 24 millimeter spot size, because we know that in the US, everybody wants to go as fast as they possibly can. So we built a chart using the majority of the 24 millimeter spot sizes to cover those same patient skin types and skin applications. You can see, let's say down the middle of the page, skin type 3, light, thick hairs, suggesting a 24 millimeter spot size, 10 joules per centimeter square, 30 millisecond pulse duration with a frequency anywhere from 1 to 2.5 hertz. Cooling should be from 1 to 3. So this chart, they can use it to manually dial in every time they treat a patient, or this could be saved into the custom settings, and then they walk up to the screen, hit the custom icon, these would drop down and they would simply describe the patient, that I'm looking at a skin type 4 with dark thin hair, and that these settings would then pop up. This is not something that we ask you to save into their machine. That really it's up to them to save this into their machine if that's how they want to practice, but we can make the chart available to them for the use of 24mm spot sizes. Documentation. Always make note of the clinical endpoints you observed afterwards. That with a 808, perifollicular edema is not necessarily a clinical endpoint that you're looking for. It happens, but it's not one of those like an Alexandrite where you need to see the perifollicular edema in order to expect results. The clinical endpoint with an 808 is really more of just a mild erythema, maybe darkening of any pigmented lesions that were passed. You might see a little bit of a halo of erythema around any of the thicker, darker hairs. And as you're treating, you might see little puffs of smoke that are coming up if you're not using the sapphire lens. But clinical endpoint, just make note of that. The parameters that were used. If you started at 15 joules per centimeter square and during the treatment you increased it to 16 or 17, make sure you notate that within your paperwork. The number of pulses, it depends on the practice if that's important, but you know, it can be a good judge of how long a treatment might take. You can always divide it out by your rep rate. The treatment number, what session are we on? Is this number 1, 2, 3, or 7? You know, it's good to know, or has the patient had prior treatments with another laser? That you can make better medical decisions based off of that information, so it's always important to track that information. Make sure every patient has that consent form signed, and the post-care discussion post-care instructions have been discussed or given. Revisit and take note of the percent of hair loss. What are we looking at right now? And pictures are always great because patients forget how hairy they were. That you know, they've still got hair and they should still have hair. No laser is going to remove their hair after 1 or 2 treatments. They need to continue coming back, and each time you're treating an active hair cycle. But what they will notice is that these hairs are getting finer and lighter and more sparse. And so a picture is always nice to be able to show them the progression in the early treatments, because not all patients are as educated as you guys are about how effective hair removal is today. Post-treatment, mild sunburn sensation, 2 to 24 hours. Post-cooling, if necessary, you can do ice pack on and off, but it's likely to be unnecessary for this laser. Avoid scrubbing and use of exfoliants. Avoid sun exposure. The hair will shed with an 808. You're looking more like 7 to 21 days. Hairs are typically not ejected at the moment of treatment the way they are with an Alexandrite, but a 808 diode is just as effective as a Alexandrite at hair removal, so it just takes a different path of recovery. Avoid shaving, waxing, swimming, hot tubs, excessive exercise until the redness resolves. And then we have some questions.
So everybody joining us on the YouTube live, if you have any questions, you can put them directly in the comment section and we'll be able to view them and we can actually reply to them directly, vocally, right now if you have anything available. If not, what we'll be doing is that we'll be actually preparing for the next phase where we'll actually be treating with patients and also setting up the echo device. And so if we have no questions, then what we'll do is we'll just move forward and we'll get prepped for that and we'll be back on. So we'll leave it open for discussion for a couple more minutes if there's anything that has come up. And then if not, then we'll switch to the next phase. We're going to move to our transition to setting up the Echo device and showing you the different handpieces and everything. We're going to be back online in a few minutes, and we will let you know when that's going to happen. We're going to put up a hold screen. So if you have any questions that you are going to come up later, you're welcome to email us at MRP, and we will also send out this link again after this video session, so you can go back and check on it as needed.
Right on, glad to have you back. Lorenzo's going to help me with showing the device setup and all the different connections and disconnections of handpieces. So you can see the Echo itself is just an absolutely gorgeous system. The design of this is beautiful. The colors are great. The brushed aluminum accents on the side, it's just a really, really attractive system. The simplicity of design on this is really gorgeous. But what you're looking at right now, the console system is completely self-contained. You do not need a Zimmer in order to operate this. The Zimmer is an optional add-on that would sit adjacent to the system or somewhere within the room. But the system is completely self-contained and can operate just as an isolated device. Right now, the foot pedal is on the floor in front of you. If you do not prefer to use the foot pedal, you want to use a trigger, that foot pedal will actually attach to the back of the machine and will move around with the machine as if it's on a cart, so no big deal. These do plug into a standard 110 outlet. Like all lasers, we ask that it's a dedicated line, that you don't have fans and tables and all sorts of other things plugged into the same circuit, but that's pretty standard with all lasers. But it is a 110, a standard computer outlet, just like you use to charge your phone or computer. So looking at the front of the system, we've got the key, the emergency stop. Every once in a while, a customer will call with any laser and they'll complain that their laser's broken and won't turn on. And one of the first things we ask is for them to check that emergency stop button. So it's just above the key, and if it has been pushed in inadvertently, let's say by a cleaning crew, all you have to do is twist it to the right and that'll pop back out. So I'm going to ask Lorenzo to turn on that key first of all. Yeah, check that. And then turn the key. It's going to boot up really, really quickly. Like within 20 seconds, you're to the calibration screen. And with all things that this laser does, the calibration will probably be the most difficult. But we're going to guide you through how to do it correctly and make it look easy. Because each time they turn the laser on, they'll do this. And first time you do it, it seems a little difficult to master, but as time goes on, you're going to make it very easy. All right, so Lorenzo, if you would go ahead and take the handpiece out of its cradle. Lorenzo can be holding this. Right now we have the contact-cooled handpiece. And this is, we're going to start the calibration process with this. So he's going to, actually, let's look at that screen. And down in the bottom right-hand corner, do you see the advance arrow? We're going to touch that advance arrow in order to initiate the calibration process. Lorenzo's going to put the handpiece into the calibration port, and you can tell by the shape of the cal port exactly which way it goes. It only goes one way. If you put it in and you don't get great contact, if it doesn't start to advance to where the laser starts making lights and sounds, you can always twist it slightly on a vertical or on a horizontal plane. Lorenzo, can you show that kind of twist motion in order to, if it's not properly seated? So what happened is initially it sits on a pressure plate in order to initiate the calibration process, and it'll run a series of pulses initially, and then it's going to ask you to now press and hold the trigger. So he's holding the trigger for 3 pulses, and now the calibration process is complete. And it has passed, and so we can hit the advance arrow to move to the next screen. Now it's going to ask us, do we just want to go into manual mode, or do we want to go through that treatment configurator? This is up to you on how you want to project. Go ahead and hit that treatment configurator button. Here's where we touch male or female, or I mentioned before, you can save in that chart if you wanted to. Right there in the center of the screen, currently it says favorites. Lorenzo's going to touch the side-to-side button, and it's going to, there we go, move to customs. Customs is where you would save those advanced settings for the 24mm spot size if you want to, and that gives you, I believe, 20 options. So you can have 20 customs saved into that. That you simply go to the customs menu and then touch the one that describes the patient that you're seeing right now. So let's go back out of this into the treatment configurator, and let's touch a, there we go, touch female for me. Let's do an underarm. There we go. Let's call it skin type 3 and maybe medium hair. Medium. There we go. And then hit that advanced screen. This is the screen that we didn't have in our slide deck. And you see how it's giving you 2 different options. It's giving you the stamped dry or gel. and then it also gives you the reverb option, the in motion. And so you can choose which version of these settings you want to use. Both of these are from the manufacturer. So whichever version you want to do, you would simply touch the arrow beneath that one. If you get to the screen and your arrow is grayed out, what that means is the spot size that's currently in the handpiece does not match up with any of the recommendations from Quanta. So what you would do at this point is swap out your spot size. So Lorenzo's going to take the handpiece out of the cradle, and he's going to press the two buttons on the gray portion in order to release the handpiece. That'll slide straight off the end, and he's going to put that on the flat portion of the top of the laser. He's going to slide the handpiece spot size selector off, and he's going to slide a new one in. There are leads that need to connect with terminals on the base, and you see it goes in one way, and that will connect right there. Now he's going to slide the handpiece back on until it clicks. If it doesn't click, you're not going to be able to fire it. You need to hear that click so that it's completely seated in place. Currently, he has the sapphire lens in place. Before you put that handpiece away, would you show how to disconnect the sapphire? So, for the standard stamped delivery, you have the option of using the sapphire lens or no sapphire lens. That if you choose to remove the sapphire lens and treat with just the pre and post cooling, it still is very comfortable for the patient, fast, easy treatments. What we found recently is that we can still do a gel-free, fast treatment with that sapphire in place. So Lorenzo's just going to screw that back in place. It goes from the inside, from the handpiece side, towards the distal tip of the handpiece. So then he's just going to screw that back into place. One trick that I do is anytime that I'm changing a handpiece or removing a sapphire lens, changing a spot size, is I do it over the top of the machine. I'll also keep a little like a rag on the top of the machine, because when you change the handpieces, you're disconnecting the cooling mechanism. And that cooling mechanism can sometimes dribble little bits of the coolant. And so rather than dribbling it down the front of the machine, you can actually land right there in the hood that covers up your spot sizes, and then just keep a towel right there so you can wipe that down, or just any of the dribble lands on the towel. It makes the experience so much greater when you're training the customer, that they don't feel like they're dribbling coolant on the front of their brand new laser. So there is a storage compartment right behind the touchscreen, and that storage compartment closes flat so that you can hide your spot sizes in there, and then you've got that little workspace right behind the touchscreen. That's where you might have some tongue blades, you might have some 4x4s sitting there, things that you need to quickly grab that maybe you don't need a Mayo stand sitting next to you for those, but they're available to you. Next thing I'd love to do before we move on to treating patients is let's show how to disconnect the contact-cooled handpiece and connect the air-cooled or Zimmer-cooled handpiece. So Lorenzo's going to do the same thing, where he presses the gray buttons on either side of the gray portion of the handpiece, disconnecting the front. That's going to remove. He doesn't have to remove the spot size, since we could just use the same spot size. But what he's now going to do is unzip the sleeve that the fiber and cooling mechanism are traced down. He's disconnected the contact-cooled engine, essentially, and that has slid backwards. Lorenzo, would you redo that? I want to show the disconnection. Here we go. So all he's doing is he's grabbing that and pushing. There we go. Separating those two portions of that handpiece base, and now he can undo the zipper of the two portions, and that can actually just tuck into the cradle, or it can tuck onto the side of the machine. You could Velcro it someplace else so it's out of the way, and it's now going to make your handpiece lighter. And now we can move on. He can take the Zimmer handpiece, or the Zimmer application, and that's going to slide in the exact same spot as the original one. So it's going to slide forward, and now the Zimmer cryo attachment is just going to slide back in and snap into place. Excellent. And now we would turn on that Zimmer, get it warming up, cooling down, whatever it does to where it's at its target temperature. And you can start your treatments as if you were treating with any other Alex Yag system that utilizes air cooling. This is a very unique feature of the BSL technology. The idea behind BSL technology is we're going to take a gold standard wavelength and we're going to put that technology over in the box. And by doing so, it allows us to inject that into a liquid fiber to create a much greater energy density than you would typically have with an 808 wavelength. So what we get is a system that operates with the safe gold standard 808 wavelength with the stability and the long-term maintenance, ease of use with that 808, but it's going to perform and act a lot more like a Alexandrite laser. So there are great benefits to this. This is why your office has chosen this laser. The BSL technology is really something unique. So right now he's got the air-cooled handpiece attached. So if we were going to proceed with the treatment with the air-cooled, we would simply turn on the Zimmer, get that ready to go, and then select our settings based on the patient's skin type and hair, etc. We are going to switch back to the contact-cooled handpiece, so here's a great opportunity to show that process one more time. He's pressed the two gray buttons on either side of the base, pulled the white portion apart, slid the Zimmer attachment off of the handpiece. That can tuck away someplace else. He's going to take the original contact cooled base, slide that back into place. Spot size, you notice, stayed in place the entire time, and now we're just going to slide that handpiece back until it clicks. There we go. And then he can re-zip that sleeve if he wants to, just to keep everything neat and tidy. Now, one trick that I've run into a couple of times is that you never want to pull on a fiber, and we know that from any Alex Yag you've ever worked with in the past. Fibers are not meant to be pulled on, so make sure that you're teaching your offices never pull the laser towards yourself or never pull on a fiber, because you can break a fiber, and that's something they don't want to do, obviously. So fibers should always be loose and free to move about, but let's say they just need a few more inches, that they can't get the laser in the correct position to treat the patient. They just need a few more inches. Lorenzo, would you undo the first Velcro strap at the lowest one? No, on the boom, correct. Let's just undo that. And what this is going to create, that gives you a few more inches. You could even do the one at the top, and it gives you just a little bit more to allow that to stretch out just a little bit further. So these are little tips and tricks that you could do with your customers to help make them comfortable when doing the treatment. The great thing about the Echo is it's got handles on the front and the rear, so it's really easy to reach across the table, grab that handle, and pull it towards yourself. Make sure to never ever pull a laser by its fiber or by its handpiece. That's how you break a fiber, and we don't want to do that, obviously. So Lorenzo, would you mind pressing close on the screen? And now you're to a manual setting screen that you could just go through here and enter your own settings that you like. The setting range, because we're only using one wavelength, it's super simple. You know, the entire range, if you're treating terminal hairs, is going to be from 5 joules per centimeter square for Fitzpatrick 6 up to 15, 16 joules per centimeter for Fitzpatrick 1. And all that you're doing is you're changing your fluence based off of the Fitzpatrick skin type, and you're changing your pulse duration based off of the thickness of the hair. So a very simple operation, and you're not having to think in 3 dimensions of, oh, well, I need to change this wavelength, and if I'm using that wavelength, I have a completely different set of parameters. This is a really, really straightforward way to treating hair removal. Your rep rate is going to be dependent upon how maxed out are your other settings? Are you at the highest possible fluence and the shortest possible pulse duration? Because if so, you're not going to be able to go as fast as you could if you were kind of in the mid-range of both of those other parameters. But you can kind of mix and match with this. We're going to give you some settings to work with, and obviously every office is going to come up with their own favorites and their own tips and tricks and things that we ask. Let's share that with us. Send that back to us. If you guys come up with something really cool that you did in a training, let us know about it. I did one recently to where I put the 12 millimeter spot size on there with a really short pulse duration, really high fluence, but had it at 4 pulses per second, and was just running and gunning on fine light hairs. Those tiny hairs that are left over after a dozen treatments or 10 treatments from a decade of Alex Yag hair removal. That was a fun one. And so when you guys come up with settings that are unique to your experience, feed that back to us. Let us know what are the best practices and what are the things that your customers enjoy the most. So we're going to pause here for a moment, and we're going to put a patient on the table, get him set up, and Ryan is going to take over with the first patient treatment. Lorenzo, thank you for your help.
All right, so we have our first patient here. We've done our consultation. He's a skin type 2. He does have tattoos, so I just outlined those in the skin marker so that we would avoid those at all costs. I have my settings here. We consulted the guide. We're using a fluence of 14 and a pulse width of 30 milliseconds. I chose a rep rate of 2.5. I'm pretty familiar with the system, so I think faster is better if you can handle it. And I'm going to use the trigger on the actual handpiece. Foot pedal works as well. It's just personal preference. So we're going to get started here with our first treatment. So make sure we all have our goggles on.
You know, pause a second right here and see how she's doing with the handpiece where she's holding that against her hand.
Over his
Oh, yeah.
so you can see it. A little bit further out.
Here.
Yeah, good.
There we go. So by holding that base against her hand, now that she's hit the ready button, it's starting to cool off the base of the handpiece. And so she can put that up against her hand to really ensure that the handpiece is cooling down adequately. And now, you know, she's ready to treat.
All right. Doing about 20% overlap. You doing okay? He said yes.
About pain, his complaint was that it's cold. So obviously very, very fast. You know, this is, I've worked with every hair removal laser under the sun, and this is something that's really unique. That's such a fast treatment, effective treatment, a safe treatment. This is really something that's special. Ryan did a nice job of outlining the tattoos. We don't want to go anywhere near a tattoo because a long pulse laser will be absorbed, you know, a melanin-seeking wavelength like 808 will be absorbed by a tattoo, but the pulse duration is 1,000,000 to 1,000,000,000 times shorter or longer than it would be for a tattoo removal laser. So what would end up happening is you'd coagulate that tattoo. It'd be a nasty little mess. So we don't want to treat over a tattoo ever, and we want to give ourselves a little safe zone around each one of those so that we're not, you know, creating a problem. You know, as he gets into later sessions, and let's say that they're the stragglers that would be inside of that white line, you could go in very, very slowly without even a rep rate, just a single pulse. You could go in and work a little bit closer to that tattoo. But for the sake of being able to run and gun today, she did a nice job of outlining a good distance between his tattoos, and she was able to go from there. That just wipes right off really easily, obviously. All right, and we're going to take a break for the transition to the next patient. All right, so next patient, we're going to do both legs. Skin type this patient as a 4, so we're using 8 joules per centimeter square with a 30 millisecond pulse duration. This is, I believe, her 3rd treatment in her entire life. So her recent treatment was about a month ago, and you might have seen the video that we shot. She's probably 6 feet tall. She's a very tall individual, so these are long legs, and I believe the video that we shot last time was maybe 6.5 minutes, 7 minutes for both legs, which is, of course, incredibly impressive. Fast treatments, effective, safe. There's lots of good stuff going with this. Ryan has divided the legs up to kind of help her as she moves, and you notice that she just has the patient rotating, and she's quietly saying, shift onto your left hip as she moves from the outside to the inside of the legs. So patient's kind of an active participant in this. We're at 8 joules per centimeter square with 30 milliseconds, and Ryan's comfortable at 2.5 hertz, which is, again, my comfort level is right there as well. So right now we're doing contact cooled no gel. We have found that while originally it was designed for the no gel option to not utilize the sapphire lens, we found that the sapphire does move fairly readily and easily without gel. So she has the sapphire lens still inserted, and the benefit that she gains from that is contact cooling during every pulse. So if you remove the sapphire lens, you benefit from contact cooling before and after each pulse. But when the sapphire lens is in place, you get before, during, and after every pulse. So you can see there are a couple of instances because of a bony prominence that she had to sort of lift the handpiece off of the tissue. And in doing so, because she had already pre-cooled with the base of the handpiece, it was still safe for that patient. So it's just much more forgiving when you do it this way. Now we do like for you to pull towards yourself because the base of this is a bulky cooling mechanism. So the gray part that you see that's touching the skin, the distal portion of that that's down towards her feet is very thick and holds its temperature very, very well. And so if you lead with that, you're dropping the temperature of the tissue down prior to the pulse. And so you notice that the majority of the time Ryan is moving in that direction. And if you ever get to a point, like she reached kind of a tendon or bony prominence down there around the ankle, and if you feel like you're not going to be able to get the pulse in like you need to, you can always just come off the foot pedal real fast and reposition yourself, put in a single or a couple pulses before you move on. Just like that. I'm not entirely sure why our patient is wearing socks, but let's go with it. Now, patient, tell me on a scale of 1 to 10, what is your level of discomfort right now?
Maybe a 2.
She says maybe a 2. I like to hear that. Our patient before described that the most uncomfortable part was the cold, that we could have likely moved his cooling to medium instead of the coldest, and that would have made him more comfortable. So that's just a good thing to know that the comfort of this is exceptional, and it's all because of that adequate cooling that we're doing with the bulk cooling mechanism of the handpiece. Now, some of these hairs on the back of her leg are a little bit thicker than the ones on the front, and so as we move over to the other leg, probably in your camera view, you'll be able to see some of the perifollicular edema that is more common with thicker, more robust hairs. You don't see it with the finer hairs, but when you do have some thicker, more dense hairs, you're going to start to see a little bit of edema around those hairs. And that's fine. It's not a necessary clinical endpoint, but it's certainly acceptable. So yeah, we'll just kind of watch that on camera as that develops. For anybody that doesn't know, the perifollicular edema is like a little red circle that you'll see around dense, coarse hairs in hair removal, and that just indicates a lot of destruction has taken place within that hair matrix. Tilts onto your right hip.
Yeah, you're right there.
Yep, just like that. And you'll notice with circles, you always need to have a little bit of overlap. The general rule of thumb is about 20% overlap with the circle. So each pulse should have an overlap of about 20%. Each line should overlap with the previous line by about 20%. And that's just a general rule of thumb. And that's to keep from having like little diamonds of hair growth in between your pulses. So this follows the same recommended protocol as any other circular spot size hair removal has for the last 30 years. Rotate back onto that right hip, please, once she finishes this line. Perfect. All right, I think we're complete with this patient. We can zoom in a little bit onto the legs, and you can see a little bit of the perifollicular edema that I described earlier. And like I said, that's normal. It's not necessary. You don't need to see perifollicular edema as a clinical endpoint, but it's certainly acceptable. When patients do a treatment with this, oftentimes we'll do an internal control where we'll treat half of a man's back with a traditional Alex Yag, and we'll treat half with the echo. What the patient reports back to us is they have an itchy, uncomfortable sensation on the Alex Yag side. They have comfort and just mild erythema, mild heat on the echo side. Both of these are acceptable endpoints for the respective devices. So it's really just a matter of what the patient experience is going to be. And so for an office that's just purchased the echo, that's likely to be an important part of their decision-making process. So make sure to really point out to the providers how much more comfortable this procedure is for their patients, and the results are still going to be, you're only killing the active hair cycle. You can't extra kill it. So both of those technologies, both of those devices will work. It's just a matter of what's better for the practice, what's better for the patient. And we will take a short break before we line up our next patient, and I believe we're doing a man's back next. Perfect. All right, so I'm going to, for our next patient, we're going to split it in half. I want to show you two different ways to address this patient. That first side, we're going to imagine using our chart that he's skin type 1, 2, light, thick hairs. And the suggestion there is 12 to 14 joules per centimeter square with a 30 millisecond pulse duration. And I like that 2.5 hertz rep rate. So we're going to do one side of his back with the 24 millimeter spot size, and then we're going to imagine that the other side, we're going to treat it as if it's light thin. And you'll notice I'm going to swap out the spot size to a 12 millimeter spot size. I'm going to increase my fluence, increase my hertz. It's going to be a different experience. Again, both work. So it's a matter of what do you see? What was the thickness, the density, the color of the hair prior to treatment? And we're just going to treat what we see. So I'm going to go ahead and get started on the left side of his back. Starting right here. I did turn the cooling down to medium as opposed to high. It seems that the high was almost the most uncomfortable part of the process. So we're going 1, 2, 3. Oop, I forgot to put it in ready mode. Actually, you know what I did that I want to do differently is I want to use a foot pedal. So I just switched to a foot pedal delivery. I'm going to start going 1, 2, 3. Ethan, scale of 1 to 10, how uncomfortable is this?
A 2.
Yep, good. All right, so there's the first half of the back using the 24 millimeter spot size. What I'm now going to do is put the device into standby mode. I'm holding the handpiece over the top of the compartment in the back. And again, that allows me to swap out my spot sizes and not dribble any of the coolant fluid onto the floor. So I'm going to press the two buttons on the side, slide the handpiece apart, slide off the 24 millimeter spot size, replace that with the 12, and then slide this back into place. Now, in a later video, we're going to show you how to save in some of the customs, or how a customer could save in their custom settings. And so the way you would now go to this is you go back into your treatment parameters and touch custom, and pick the one that says skin types 1 and 2 fine light. So now I have a 12 millimeter spot size on here. I'm going to just manually enter in what I want. I'm going to want about 20 joules per centimeter square. I could even go up from there if I wanted to, but let's do 20 joules per centimeter square at 10 milliseconds. So now we're chasing the finest and lightest of those hairs. Now, I'm using a smaller spot size. I'm very comfortable moving at a faster rep rate. So I increase this up to 5 hertz, and it's going to be a very, very different treatment than the previous one, but again, I like this for the finer, lighter hairs. All right, 1, 2, 3. Ethan, scale of 1 to 10, how uncomfortable is this?
This is a 1.
Okay. And this delivery will be very comfortable for people who are used to doing laser genesis treatments. Very similar, 5 hertz rep rate. And you're just doing a serpentine movement where you round your corners. Top to bottom. And even though we're only using the 12 millimeter spot size, this is still a very fast treatment. We're all done with that side. Now the 5 hertz is, again, it's up to your hand-eye coordination, what you enjoy doing. I find this to be very relieving. I'm an old laser genesis guy, so this makes a lot of sense. It's very easy for me to perform. But if you do want to move slower, you can certainly set it down to 2 hertz or 3 hertz or wherever you're comfortable moving it. But that is another safe and effective way to do hair removal on a patient skin types 1 and 2. Fine light hairs, and you need that shorter pulse duration in order to confine to the TRT of those finer, lighter hairs. That's where this setting might come in, and you might enjoy doing this. So we're going to take a break here, and we'll come back with a few more things before we're in for the day. Excellent. Hey, we want to take an opportunity to answer any questions you guys may have. You know, we're always available to answer questions in the future, but if there's anything you saw that we've left out today that you really want to dig into, now's a great time to answer questions like that. Also, we may address just some common questions that you get. I think with every single hair removal training I've ever been a part of in my career, 20 years in this industry, somebody in that room is going to ask about the number of treatments. And are you able to do hair removal in fewer treatments with this? Well, I mentioned before that we're only treating the active hair cycle, that anagen hair phase. So a good effective laser, something with the visible wavelengths like the 808, 755, those are going to treat the active hair cycle with each treatment. And so typical rule of thumb, you're talking anywhere from 5 to 8 treatments regardless of the technology. Where it gets to be a little bit more questionable is that some people use a 1064 in order to be safer on the darker Fitzpatrick skin types. Well, yes, 1064 is safer, but it's not as effective. And so any of you that have used a G-Max Pro, Ryan's history was with a G-Max Pro, and so you would never represent to a patient, let's say a Fitzpatrick 5, that hair removal is going to be done in 5 to 8 sessions because a 1064 simply doesn't have the absorption to pull that off. That yes, it's safer, but it's not going to be as effective. And so with the 1064, you might have suggested it's more like 12 to 15 treatments, and you may not see an overall end result that you would get with another wavelength. So with the 808, I think 5 to 8 sessions is a very reasonable expectation. Depends on the patient, depends on the aggressiveness of the settings, and depends on your spacing of their treatment intervals. The treatment intervals is super important, and I gave the anecdote earlier of the doctor who was upset because he was on treatment number 8 with his patients on legs and was getting no result. And once I pieced it together, I was like, wait a minute, you only bought the laser 8 months ago. How could you be on treatment number 8? And so once we figured that out, it was the spacing was what was all wrong. So if your intervals are correct, you will more than likely see good clearance and getting to that point of where it's going to take longer than 2 months to get that 30% regrowth. And that's really what we want to look at is how far out are we spacing that 30% regrowth? It's considered permanent hair reduction or temporary hair removal when you've got that regrowth is taking an excessively long time to regrow back. And then the solution to that is treat them one more time.
Yeah, so you have a few questions actually. The first one was for the first patient. What was his hair texture, color, and had he had treatments prior?
Will you answer the question about the first patient and hair
Yes,
texture,
that was
color?
when we-
The question.
Okay, so the first question is what is his hair texture and color, and has he had treatments prior? So for that patient, no. His hair we were starting off with a coarser setting because of that, and he had dark hair. Mm-hmm. I'm trying to remember.
Sorry, now we're trying to remember which one of our
I know,
friends
I
came
am.
first.
It's not that we did that many patients. I'm so sorry.
Yes, exactly.
He was he was a skin type 2, had darker hair.
That's right.
So we used a 24 spot size. I can't remember the exact fluence, but I think we mentioned them earlier. But
I think it was
really
14 joules per centimeter.
Okay,
Yeah, I think it was 14 and 30.
Yeah, so he had thick dark hair. Sorry to answer that more precisely. He had thick dark hair, skin type 2.
And then your next one's right here.
The next question is, does the Echo do any other applications than
Yeah, let me take that. So all hair removal lasers are capable of doing other applications, whether it's vascular or people do like skin toning, a la laser genesis type treatments. All hair removal lasers have been able to do that. When Quanta brought this to the U.S., they did not seek out clearances for either pigment or laser toning, facial, etc. There are vascular settings. There are guidelines for vascular treatments. But really, we want to focus on selling this as a hair removal laser. That's really where this comes in, is that while all of the hair removal devices are capable of doing pigment, including the Echo, you can treat pigment, you can treat vascular, you can do laser toning. Really, the emphasis of this system is on hair removal, and so that's been our focus. The setting guidelines for vascular that are in the manual, really that's for somebody that if you're used to teaching vascular with an XLV or with even a G-Max Pro, something like that, the clinical endpoints are always what's most important in a vascular treatment. It's not about what's the setting. You don't just put the setting on there and run and gun and start treating people's leg veins. It's always, are you seeing that sputter, surge, or spasm? What do you see at the moment of impulse? If you see the sputter, surge, or spasm, you're on the right track. If you see nothing, your pulse duration's too long. If you hear a pop, your pulse duration's too short. The rules of vascular lesions hold the same with this device as they would with any other. I've used 808 for leg veins before using a light shear. Similar indication, similar application. We would likely use a 12 millimeter spot size when doing that, and that's all in the guidelines for vascular. But I would advise staying away from training vascular on the echo unless you personally are used to using vascular lasers and training on that. I think you'll find a lot of comfort doing this. It'll behave the same as any of your other lasers do. And those guidelines that are in the manual are a safe start to get you where you need to be, and then you're going to need to make adjustments based on what you observe. Lorenzo, are there plans to seek out clearances for pigment and toning? We only market it for hair removal, but certainly if somebody asked me candidly, can this do pigment? I'll be like, yeah, I use 45 joules per centimeter square, 12 millimeter spot size, works great. But is there any sort of ambition of seeking out those clearances, or are we just good with hair removal and vascular at this point?
There are for sure ambitions to register also for the clearance of other kind of treatments like pigmented lesion and also for tightening procedures. So far it's something that is taking a little bit of time, but in the future the aim and the ambition is to obtain also that clearance.
Excellent. Yeah, I mentioned before, I'm happy to show somebody how to make that work. Again, it's clinical endpoint. If you're treating a pigmented lesion, you want to see that darkening of the pigmented lesion. So what fluence do I need to be at in order to reach that clinical endpoint? So it'll operate just like any other hair removal device. And that's why we feel like a train the trainer for a system like this can be virtual, because if you've worked with any Alex Yag system or even some of the diode systems, you're going to immediately be able to plug and play what you know to be true already into this. What this does is it just opens up new possibilities, new speed capabilities, the ability to treat without gel. That's something, the traditional diodes can't do. It's this BSL technology that allows us to do something that was never done before. So this is kind of a 2025 approach to hair removal. And if this is available and you're looking at everything within the market, unless you're just shopping on price, the Echo should be at the top of your list. It's a compelling technology, and we've had a lot of really dialed in laser practitioners in here, and they've done side-by-sides where we do one device on one side of the body and the other on the other, and the Echo wins every single time. It's such a great experience, and you guys are going to have a great time training on it. It's just exactly what we say it's going to be.
We don't have any other questions currently, so is there anything else you want to wrap up with?
Yeah, no other questions right now. I think that you guys should know that Echo is something that's near and dear to my heart, and I'm happy to help you out as you guys get out in the field and start working with our customers. That we want to support you. We want for you to feel comfortable and confident with this system. Please do send any questions. My email address is cole@mrp.io, so really easy to get access to me, and you can send me questions. You can request things if there's something that you want to see in particular. One thing we weren't able to shoot today that I'm going to shoot is just a module, because I think it should be available for the customers, and that's how to save in those custom settings. So we've got this chart, and it would be nice for an office to understand how they can save that chart into their own system. And I can shoot a video on that maybe later today, and we can send that out to you guys. That's going to be important for them to see, that they can just literally walk up to the machine, hit the customs button, it'll drop down, and then they just select the one that describes the patient they're looking at. So it's even faster than the GUI that's built in with the treatment parameters. So we'll continue adding these tools to your workshop and give you the things that you need, and we're going to get more of these out in the field, so you'll hear a lot more about the Echo in the coming weeks. Thank you all for joining today. I really appreciate your attendance, and we look forward to seeing you out in the field.